We are really pleased to have the opportunity to share with you today our mobile app development experience. Indeed, we decided to develop this app 6 months ago. So we decided to design and deliver a new app for healthcare professionals based on the Orion Health APIs. First, we want to thank Orion Health and the French CEO Olivier Smirou, who invited us here to speak about this recent successful experience. So we succeeded designing and delivering a mobile app within 6 months, thanks to our former experience in mobile app development. So far, we developed 9 apps. So we reused as many elements as we could to do that in that short delay. But let's start with the team presentation. So here is Maya, a clinical an oncologist working at Cezanne as an e-health medical expert. She will show you in a few minutes the mobile app we developed. And I'm Héloïse. I also work at Cezanne as an application specialist for TerrySanté, a solution based on Orion Health Coordinate and Clinical Portal. Sadly, our main speaker should have been our solution manager, Arnaud. But he had an emergency this morning, so he couldn't come with us. So I'm really sorry for you and for me. So thank you for being indulgent with me. So, of course, we did that only 3 of us. We had a lot of different profiles working with us, such as a product owner, a program director, technical integrator, UX designers, and also a strong direction support to do that. But nothing would have been done without our industrial partners. So Parsis is a software development company we already worked with, and Orion Health, the API designer, and also Accenture, who is our system integrator. Before explaining the way we worked on the app design, a few words about our company, Cezanne. So who are we? Cezanne is a 100 collaborators company providing health solutions and services. We are the Paris Region Healthcare Board, a non-profit organization working closely with our regional healthcare agency in order to offer our members solutions and services responding to their needs. So who are our members? They are public and private structures as hospitals, but also medical or social structures, global practitioners as so far. And the solutions we deliver to them, they are telecom services, data hosting services, data exploitation, as well as business applications. Among those, PACS, telemedicine, and the Orion Health Pathway Patient Solutions, TerrySanté, which is the name of our program based on Orion Health Coordinate and Clinical Platform. So we decided to build our own path by developing our own TerrySanté mobile app, motivated by 3 main reasons. First, Orion Health framework was changing, so the current mobile app development stopped, but we couldn't wait to get new features in the app to respond our healthcare professional partners' need. And secondly, developing this solution appeared to be a possible key booster for the users also of the platform, responding to the needs of the professional we didn't address so far. And finally, a statement of our tutorship, the Regional Healthcare Agency, was made setting out its desire of us fostering our presence on the mobile market segment. So we did it. How? I will present you the scope we decided to address in the first version, why that scope, and how we determined it through an agile user-focused methodology. So our first approach draws mainly on survey-based data collected in real-world conditions with the final users, the professional healthcare. So we observed them, we interviewed them in real work situations, we listened to their needs, and starting with the results collected, we imagined how a mobile app could help them in daily practice. These experience analyses allowed us to establish the minimum value product perimeter, so we identified the need of additional features we had to develop as the patient list access, including the contact information, so they could call the patient, for example, directly from the app. And they wanted also to contact the same way all the members of the circle of care, so the circle of care access and the contact information access. The possibility of exchanging with one of several members of the circle of cares were also in the minimum value product perimeter. They wanted to discuss with them, possibly with an instant message service. So we developed a secure chat. And it happened that sometimes the instant messages could be important for the patient files. So we developed a way to convert an instant message into a note, a shared note. And they wanted to have an access to the documents, so the clinical reports and all that directly from the app. We also added that. And finally, the regional healthcare service providers map location. So from there, we designed dynamic prototypes of the app we imagined according to the users' needs we collected, and we organized user clubs to submit it to them. We took into account their feedback up to validation. And finally, developments could begin, integrating the mobile app with the Orion Health Coordinate and Clinical Portal. To do that, we used 7 standard APIs, and we customized 4 more. So we could offer to the users an application, a mobile application, integrated with the clinical platform according to the scope designed, using a little bit more than 10 APIs. And also, we integrated 3 more services that we integrated about the same way: a chat server, a healthcare provider directory, and a regional authentication portal access. So we could offer in less than 6 months to the professional a second solution to get and share information from and about their patients' medical files wherever they are, directly via their mobile phones. So please now have a look on how it looks like, watching a demo we recorded yesterday. Yeah. And that will be presented by Maya, who will finish and conclude thereafter, telling you a few words about the first uses.
Okay, so where is it? Here. So let's start. So let's imagine. No, sorry. It's here. Et pour la démarrer, c'est où? Non, voici. Okay. Okay. So let's imagine I'm a healthcare professional. Here I enter my PIN code. Here I arrive where I left, and then I go to the main menu, where I can find my patient list. I can search for a patient. I can have my memo, my to-do list. I can use a chat where I can receive or send instant messages or picture. And here I can search for a healthcare professional. So let's imagine I'm a home visiting a nurse, and I'm doing my early morning turn, and for example, I need to check at first my memo. So, so for the first use, I have to use login and password, but after just the PIN code. Here my notes, if I do one, it appears as done. If I go and done, here you see it. I can delete some. Okay, and so now, for example, imagine I want to go to see a patient. Here I have my patient list. here, and for example, I want to go to see Mrs. Demo, so I have the notes, I go to the notes, I see she was bleeding, I see there are some pictures, so I want to look to the picture. Okay, so she has spontaneous hematoma. And okay, the doctor said she needs a blood count. I can call the patient if I want to see her to be sure she's at home. And I can go here to documents and see the blood result here, blood test result here, for example. Previous one will be here. I can check if I need to compare. Okay. And now I'm at her home. I want to see the cycle of care because I want to send a message to her doctor, her family doctor. So here I click here. And then, okay, here I have some previous messages. If I want to add somebody, for example, a biologist, I go up here. I will add here biologist. Here I will write his name. Okay, done. Here. So here, and for example, I want to take a picture. Okay, let's take a picture. Here, okay, hello. Here, right. Okay, use photo. Okay, and I want to say Mrs. Demo has a jaundice. She probably have a liver problem, maybe something with her treatment. So, okay. I don't write very fast. So here's a note. I want this chat convert into a note. So I click here. So there is some time. It's not so fast, but it's not so long neither. Here. And okay, it will tell me yes. Okay, has a note. Here I can make change. Here okay, let's delete that. And write jaundice. Okay. Okay, so it's done. Okay. So now I can go to the notes. I will see. Okay, perfect. My notes is here. Okay, perfect. So now, for example, I want to see if her doctor is online. Okay, so let's go back to the chat, general chat. Okay, here. Here, chat. I will choose here the messages. Up, 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 here. Correspondent. Eloise, yes, she's online. Oh, she's writing to me. Okay, let's close. Okay, so she answered to me. Okay, perfect. And now, for example, if I need to search for a cardiologist for this patient, I go back to the main menu. Okay, here, I go here, here. Okay, and here, for example, Paris, and here a cardiologist, and here I will search. Okay, done. So next steps here. Okay. So next steps. So now we're going to explain to you how we are going to deliver the solution to the users and prepare the V2 mobile app. Okay. So in parallel, the delivery team is offering us the solution to 15 beta users. okay, before distributing the solution to all the users. And the conception team is working on designing a V2 product by adding 2 new features. The first one is to allow some change in the cycle of care. Right now, we cannot do it in the V1. And the second one is to view all the medical reports. Now we can just see the blue test, the lab results.